Morning. Good morning. Good morning. Just giving everybody a chance to grab a seat. Great. Well, good morning, everyone. I'm David Skorton, the President and CEO of the Association of American Medical Colleges, and thrilled to have all of you here in person in this wonderful facility that was designed and made possible by my predecessor, Daryl Kirch, who you'll hear from later. Daryl, it's wonderful to have you here. Wonderful to have you here. And on behalf of the whole AAMC family, I'm honored to host you at our headquarters, and a warm welcome to those of you who are joining us virtually as well. In conversations with many academic medical centers who are members of the AAMC, we continually hear that well-being of the healthcare workforce in general remains an ongoing challenge, perhaps the ongoing challenge of our time. This was certainly true well before a global pandemic, a necessary but painful racial reckoning, and all kinds of other pressures on the healthcare system and our people. Just one single example of many that we could cite, the tragic loss of Dr. Lorna Breen, who worked in one of the hospitals in the New York Presbyterian satellite that I was also a part of, a physician in New York who died by suicide in 2020. This has hit home particularly for me because of my familiarity with Allen Hospital and those who worked with Dr. Breen. This type of tragedy, even for a single person, is absolutely unacceptable. And we're here today because we believe, and those we follow, like Dr. Kirch and others, believe is not only unacceptable, but we believe it's avoidable. My sincerest gratitude to the National Academy of Medicine for the extensive effort that you have invested, Victor, in creating this action collaborative and in moving forward evidence-based multidisciplinary solutions to a very difficult problem. And I'm especially grateful to the co-leads of this effort, including, again, my good friend and predecessor, Dr. Daryl Kirch, a psychiatrist who has devoted much of his career toward advancing mental health issues for the country. Thank you for your leadership, Daryl, and also my sincere gratitude to my colleague and friend, Dr. Victor Dzau, who as co-chair of this collaborative along with Daryl, has demonstrated the National Academy of Medicine's commitment to clinician well-being and resilience. And permit me to wax just for a moment eloquent about Victor Dzau. It's a challenging job to be the head of the National Academy of Medicine, and the National Academy of Medicine is peopled by very distinguished individuals, each one of which has a very strong opinion about nearly everything. And Victor has managed very, very effectively to take into account those opinions and that individual wisdom, and to lead all of us in the National Academy forward with grace and compassion and strong execution. Victor, congratulations for all that you're doing. I ask you to come up here now, and I hand over to you to tell us about the national plan. Thank you for being at the AAMC. Thank you for all you do. My colleague, Victor Dzau.
I paid David to be my publicist. He is so kind, and he's certainly one of the nation's leader in health and medicine, and in many ways, other areas as his role in Smithsonian and others. So, David, first of all, thank you for welcoming to your home. It's a wonderful area, and thank you for your support. AAMC, through Derek Kirsch and now you, have been the foundational support for this initiative, and we won't be here without both of you and the entire organization, so thank you. Vivek Murthy, Surgeon General, Daryl Kirsch, and Tom Nasker, and now Tim Brigham, they're my co-chairs, and they've just been wonderful colleagues to work with. And on behalf of them, I want to welcome all of you. Vivek, you missed earlier, we had a fire alarm. Just when I was about to start in a closed session, I think we needed everybody to be waking up, so they stopped drinking coffee, you can notice, and they're now here. We did talk about the importance of this mission. All of you know that, and the criticality of your commitment and participation to this journey that we've started some 6 years ago. And going forward, we have a long way to go. Things are not getting any better. I thought it should be, but it's not. Maybe we've done some changes, and I think all of us know that. We can search ourselves to say, have we made the difference? I say yes, but not enough. So our journey is ahead of us, and we're committed to, therefore, another phase of this, and certainly like to institutionalize this entire issue for the nation and globally going forward. Okay, so today, we certainly want to welcome the public as well. In addition to the members, I understand there's over 1,500 registrants by Zoom and a few people in person. That's wonderful. And, there's so much, we need more attention to this issue. I was talking to Judy Woodruff not too long ago to say, you have to do a session on this. And she's interested. So you may or may not know she's about to retire, but she had a health editor talking to us about how to get more national attention on this big crisis that we face with. Well, in that context, we're very fortunate to have the attention of Congress. And this morning we have 3 people, leaders from Congress, who'll be sending a message to us. This is going to be by video, but importantly, that's Representative Amy Bera from California, Representative David Joyce from Ohio, and of course, Senator Tim Kaine, who's been such an important figure in this area. So let's hear from them, from their messages, and I think you'll be impressed how we have the attention of the U.S. government and Congress. Now let's get some things done. Can I have the video, please?
Hi, I'm Congressman Ami Bera from California's 7th Congressional District, the Sacramento suburb. I'm also an internal medicine physician by training. I want to thank the National Academy of Medicine for their groundbreaking and incredibly important work on physician burnout and physician suicide and the mental health pressures on healthcare professionals today. A lot of this work occurred before the pandemic. So this was an issue pre-pandemic, but we all know the pressures that doctors, nurses, and other healthcare professionals have come under during the pandemic, the responsibilities that were placed on them. And we know that is leading to tremendous burnout and physician suicide. When I talk to the folks that I went to medical school with, I'm 57, and many of them are starting to think about leaving the profession. In fact, several physicians every day leave the profession. That's going to put an incredible strain on the remaining healthcare providers. We have to address this issue. We have to focus in on provider and physician mental health well-being. We have to do it actually before they go into practice. We need to focus on this in medical school and make it a priority. Let's build resilience. Let's make sure it's not a sign of weakness to reach out and ask for help. It's a sign of strength. So let's provide those resources. Let's understand the strain and pressures that doctors are under and nurses and other healthcare providers, and let's address it, because not only is taking care of our providers, the doctors and nurses and healthcare professionals that care for us, the right medicine, it is also the best way for us to take care of America's patients. Thank you. Thank you for your work. Be well, be safe, and be kind.
Hello, everyone. Congressman Dave Joyce here. It's my pleasure to join you in celebrating the release of the National Academy of Medicine's National Plan for Health Workforce Wellbeing. These past 2 years have been a stark reminder that healthcare workers don't just deliver life-saving care to their patients, they willingly put themselves in harm's way to do so. As the co-chair of the Congressional Nursing Caucus, I understand how important it is for doctors, nurses, physician assistants, and every other individual who works in healthcare to receive the support they need to thrive in their professions and continue to provide high-quality care to the American people. That's why I have consistently championed legislation aimed at supporting our healthcare workforce, from providing additional support for primary care providers in medically disadvantaged communities to reauthorizing critical nursing workforce development programs. I can assure you that I will remain committed to reversing trends in healthcare worker burnout and will continue to fight for your needs here in Congress. I applaud the work the National Academy of Medicine is doing to prioritize the mental health and the well-being of healthcare workers, and look forward to working with you all as we turn your recommendations into concrete policy solutions.
Hey everybody, Senator Tim Kaine here, and it's really great to join you by video today. Let me start by thanking the National Academy of Medicine and the Action Collaborative on Clinician Wellbeing and Resilience for your important work on such a critical issue. I also want to recognize the Collaborative's 4 co-chairs for their tremendous dedication. Dr. Victor Dzau, Dr. Daryl Kirch, Dr. Vivek Murthy, and Dr. Thomas Naska. As you know all too well, physicians and other healthcare healers have long experienced high levels of stress and burnout. This was before the pandemic, but COVID-19 has only worsened this problem, and the last 2.5 years have shed light on just how serious this issue is. While helping patients fight for their lives, many frontline healers have been coping with their own trauma, losing patients, colleagues, family members, being afraid for your own physical safety or the safety of the family members you go home to every day. That's why I've been such a strong advocate for the mental health and well-being of our frontline workers and our other healthcare healers. You have to look out for those who spend their lives looking out for other people. My legislation, the Dr. Lorna Breen Healthcare Provider Protection Act, does just that. Lorna, the namesake of the legislation, was from Charlottesville, and Dr. Breen was a talented and dynamic emergency room physician serving on the front lines of the pandemic, supervising an emergency department and hospital in New York City. Tragically, we lost Dr. Breen to suicide in the first weeks of the pandemic. She worked at a hospital that was just flooded with cases. She was doing all she could to save her patients. She got COVID herself and went home to quarantine, but then came back as soon as she could, probably too soon, because she was so focused on trying to help others. And what she saw when she returned, the scale of death and illness around her, with patients dying in hospital beds in the hallways, put her into a mental health tailspin that ultimately cost her her life. And it's a painful reminder of the damaging toll the pandemic has taken on frontline providers. Lorna suffered from something very common among health professionals, even in the best of times: the deep stress of interacting with patients day in, day out, helping them, worrying about them, celebrating them, praying for them, mourning for them, asking yourself, is there something I could have done different? Over the last 2.5 years, I've gotten to know Dr. Breen's family, and I've been just honored to have worked with them on legislation that honors Lorna and provides training, resources, and support needed so we can work to prevent suicides or other mental health issues among our wonderful and talented healthcare professionals during this crisis and in the years to come. The Dr. Lorna Breen Healthcare Provider Protection Act provides a much-needed investment in the mental health and well-being of our healers and frontline workers. I was pleased that last year the American Rescue Plan included funding for provisions modeled after the bill. And with those funds in January, over $100 million in grants went to our hospitals, health systems, med schools, other training schools, and professional associations across the country to reduce burnout and promote well-being among our healthcare workforce. I'm particularly proud to say that in March, the President signed the Dr. Lorna Breen Healthcare Provider Protection Act into law. I was able to attend the signing ceremony in the Oval Office with Dr. Breen's sister and brother-in-law, Jennifer and Corey Feist, with Dr. Breen's mom and Dr. Breen's niece, Charlotte. The President was deeply touched by their story and took time to learn more about Lorna and her experience, but also to learn about the efforts of this family to turn a very, very unspeakable tragedy into motivation to help others. I'm so encouraged by these steps to ensure that we're caring for those who care for us. But we know so much more has to be done. That's why it's important that we continue to talk about Dr. Breen's experience and the experiences of all other healthcare healers like her. The work of Action Collaborative in this national plan will lay out concrete steps that we can take to address the well-being of those who care for us. So thanks again for being tireless advocates for our healthcare healers.